patients with benign essential blepharospasm, we generally inject medication subcutaneously in 8 to 9 sites, 2 in the upper eyelid, 1 or 2 just behind the lateral canthus, 2 in the lower eyelid, and 3 just at or above the eyebrow. The upper eyelid injection should be placed far medial and far lateral to avoid weakening the levator muscle, thus producing ptosis, and they should also be given close to the eyelid margin. The lower lid injections should also be placed close to the lid margin. Each injection should produce a slightly raised area. The most medial brow injection should be placed close to the region of the corrugator and procerus muscles near the midline. Each injection consists of 2.5 to 5 units of Botox, except for the lateral canthal injection, which consists of 7.5 to 15 units. Before Botox is injected, the skin over the areas to be injected should be cleaned with an alcohol wipe. The patient should be instructed to keep his or her eyes closed during this time to avoid getting alcohol fumes in the eyes. Precise placement of the upper eyelid injections often requires that the skin of the upper eyelid, which may be somewhat redundant due to the age of the patient, repeated manual elevation of the eyelid in order to open the eyes, or both, be lifted a bit. In addition, the risk of inadvertent injection into the wrong area because of patient movement can be reduced by placing the little finger of the injecting hand on the patient's face during the injection. Thus, if the patient's head moves during an injection, the hand will move in the same direction as the head. Patients with blepharospasm who have significant contractions of their forehead muscles may benefit from injections of Botox directly into the forehead. The injections are spaced equally across the entire area and include 2 sites in the region of the procerus and corrugator muscles. Patients with MEJ syndrome receive the same periorbital injections as patients with benign essential blepharospasm, although I tend to place the lower lid injections a bit more inferior in patients with MEJ syndrome in the hope that the Botox will spread to the midface region. Some patients with MEJ syndrome have sufficient involuntary movements of the mid and lower face that they benefit from injections of Botox in those areas. In general, the injections should be given in the same locations and with the same dosages of Botox on both sides of the face. The dosage ranges from 2.5 to 10 units per site.